well, the scare tactics live on. Protesters are holding mock funerals, threatening to ship the ashes of dead people to Republican lawmakers. Some planning, quote, die-in events. Get it? And, of course, the ads are already coming out. As you could imagine, they are targeting Republicans all ahead of 2018. All about health care. Watch.
Congresswoman McSally just voted for a disastrous health care repeal bill opposed by the American Medical Association, AARP, and the American Cancer Society. McSally voted to raise your costs and cut coverage for millions, to let insurance companies deny affordable coverage for cancer treatment and maternity care, and charge 5 times more for people over 50. McSally voted yes, even though the bill makes coverage completely unaffordable to people with pre-existing conditions. Congresswoman McSally, how could you do this to us?
Ooh, are you scared yet? Question is whether or not these over-the-top tactics actually work. What's going to happen? Because 2018, my goodness, that's right around the corner. And Republicans, you know, they could face a backlash at the ballot box, all as a result of Obamacare repeal and replace. Mercedes Schlapp and Don Calloway are back with me. And Mercedes, I mean, look, you know, that ad, when you lay it out there, you think about the fact that, yes, insurance companies can charge 5 times as much for an older patient as they can for a younger patient. But I'm guessing the older patient is that much more costly to the insurance company than the young 22-year-old patient.
Well, the tactics definitely work. I mean, we saw that even during the time of Romney's presidential campaign when they were talking about entitlement reform, and the Democrats basically said they're going to, you know, throw the seniors over the cliff. So it is effective. I do have to say that the script that hasn't been written and the ads that we're not seeing enough of is the Obamacare failure. It's a fact of the collapse of the individual health market system, the fact that, you know, consumers have fewer choices, the fact that we've seen premiums rise, skyrocketing in so many of these different states. That's a story that's not being told effectively, I think, even coming from the Republican side. And it gives the Democrats an advantage to sell this story of this one bill being a bad bill.
Don, the problem is it's like, what'd you do for me lately, right? I mean, in other words, I think that this election was a referendum on many things, including Obamacare. And so now the American people, they want some kind of fix. But I got to tell you, this is complicated stuff, and there is no easy fix to this. There is absolutely no easy fix. So do Republicans now run the risk of having opened Pandora's box of making it seemingly worse? Well, let's not forget, as Mercedes points out, I mean, there are states where you can't even get any health insurance anymore because all the private insurers have headed for the hills.
Well, Trish, who knew that health care could be so complicated, right? But there's a couple of things that are very important to point out about the business case of why this repeal bill was a very, very bad idea. As you point out and we discussed last week, this age tax for patients aged 50 to 64 could be very, very detrimental to those who now have to pay potentially up to 5 times the cost.
Right, but they do cost the insurer more, right? I mean,
that's speculative.
I'm sorry, but if you're 75 years old versus 22 years old, you're going to be more costly to insure.
Absolutely. It's ages 50 to 64, but what if you're a very healthy professional 52, 55-year-old? You're not that much of a greater cost risk. Secondly, if you consider
a 22-year-old?
Well, you know, it's all speculative. Secondly, what about the decimation of funding?
I mean, you know, the stats are on the 22-year-old side. Sorry.
There's also a substantial decimation of funding for Medicare and Medicaid in this bill, which will absolutely ruin the federally qualified health centers that serve
Right, because the idea is you shouldn't be getting a government handout. The idea is you go out and you pay your fair share like everybody else. If you can afford it, you're there.
It's not a government handout. The FQHCs are often the only medical provider for so much of the Republican rural voting base, and those will be absolutely decimated under the current proposal. And it's very important that we talk about pre-existing conditions here. Yes, this current bill does protect those with pre-existing conditions if and only if they maintain contiguous coverage.
Well, what does that mean? You know, I know you're filibustering this segment, but let me just make this very clear. When it comes to the states, actually, there is a requirement in that bill that they would have to make sure that the states meet that pre-existing condition requirement. If not,
If the patient
it doesn't work.
If that patient maintains contiguous coverage, then
all I know
so
is
what's that mean? You can't
hang on,
move?
hang on.
I think that there's something very important is the fact that this is what happens when you create this type of entitlement. Then the mentality in the American person is saying, well, I have to depend on government in order to pay for my health care. And so what's happened
is not a
what I'm saying is that it's very difficult to roll back that entitlement, which is why we're seeing what we're seeing in terms of this inability
Mercedes,
to
let me jump in with a question to you. Hang on, Don. I have a question to Mercedes because, look, I've looked this through, and I have my concerns on both sides about this. I'm not playing politics here and not being partisan. My concern, one, when it comes to pre-existing conditions, is you're going to put all those people in one pool, and now the state has to negotiate on behalf of those people. That concerns me because I don't trust the state to be able to have a decent negotiation with those insurance companies. I think those insurance companies are too smart. The other thing that concerns me, Mercedes, is this idea that if you somehow lapse, if you don't have insurance for 2 months, they can jack up costs as much as 30% because that feels onerous to me. It kind of feels like the credit card companies. You miss one payment, and instead of paying 6 or 7% interest with the teaser rate, suddenly you're slapped with 32.
Right. Well, I think that's why you're going to see the Senate has decided that they're going to rewrite the bill. I think they'll take the better parts of the House bill. And I think that, there are a lot of those concerns, including the fact that, for example, they are concerned about cutting off Medicaid expansion to the states, also on dealing with the premiums for older individuals. They're very concerned that they want to see some sort of safety net there. And so it is kind of what you find when you see the free market battling it out with the government to a certain extent. So I think that this has
got a lot of work.
It is a lot of work, but the fact is that the way we were going, the road we were taking with Obamacare is just not an option.
Sustainable. I agree. The insurance companies, they weren't going to be in that business anymore. You were heading straight to that single-payer system where it was the government or nothing. Hey, Don, good to see you. Thank you for bringing up all those points. Mercedes, a pleasure as always.
Thank you.